Good morning. I am Dr. Satish Reddy, Orthopaedic surgeon and Managing Director of Aster Prime Hospital from Hyderabad.
Sir, first of all, thank you for being part of Healthcare Product Summit 2020. Tell us your association with this so far. How do you find the conference?
Been here since morning as kicked off with a small session and been judged on the various products which are being displayed here, as well as some of the IT enabled stuff which is around. And I think this is one of the interesting conferences in regards to what you want to know about the future of healthcare and in which direction healthcare is taking up, going ahead in the coming days.
Okay, sir. Before I get into the details of it, I just wanted to ask you, how is this judging process going on here? So how are you judging the products that you're selling? And any interesting product which you like?
Yeah, somebody came up and said, I was just interested in talking to you because the way, with the aggression with which you guys have been judging this, we are being very diligent with various parameters in which we are judging in terms of what they've been doing and what their future looks like, how they've been able to sustain, what are the awards they got, and what is the funding they have achieved. So there are some interesting businesses up here. I think we'll wait for the final judgment when it comes from all the judges.
And getting back to the theme of the conference, so let's rethink health and care is what the theme is. So how do you associate it with this theme, sir? You or your organization, Aster Prime Hospital, how is this associated with this theme?
I think rethink healthcare is a very interesting and pertinent way of looking at things in the present day world. In fact, when we started this morning, we were looking at the number of deaths which have happened in the recent past among the doctor community. We've had about 5 young doctors who had expired in the last week or so. So I think this is something which we need to ponder upon and understand about rethinking the way we are looking at ourselves as well as healthcare industry in general. And unless we as doctors start to look at ourselves, I think only then we can take care of our patients better.
Right, sir. One more question, sir. According to the theme, the focus should be more on the preventive care. What do you think about it, sir? What is Aster Prime doing in that aspect of keeping their patients fit?
I mean, I think there's no other way to look at healthcare. There is the only one way to look at is preventive healthcare. I mean, it's not healthcare if you're actually going to treat once an event occurs or a disease occurs. And Aster Prime in general has been one of the our focus has been in doing a lot of CSR activities in trying to prevent disease occurrence. In fact, we have won an award last year here in the same hosted events where we got the award for best CSR activity in the state.
Yes, sir. So how are you interacting with the patients, sir? Other than CSR, the existing patient lot or the upcoming patient lot, how is your presence in the social media or in various other mediums so that you are in touch with the patients all the time or giving them the idea of how to be healthy and how to be preventive?
I think our reach as such is not up to the mark. I would say we have not been that active when it comes to reaching out people in terms of preventing disease occurrence or preventive healthcare. We are doing it more on person-to-person basis or when there is actually a physical touch. I would be happy to look at introspect and see how we can do it in terms of reaching out to larger population using various other media available in the present day world. So that's something I would like to think about and do better.
I probably think you find your answer in this conference, sir. And thank you so much for being part of it once again.